Okay. And you're on.
What is a billion-dollar industry that is slowly sucking the life out of the youth of America? The vaping industry, with its promise of a safer way to quit smoking, has become less of a tool for smokers and more of a new, much more intense addiction. According to FDA.org, in 2024, 7.8% of high school students reported current use of e-cigarettes on a daily basis. This is becoming a trend among our youth. Today, I would like to discuss three aspects of this widely spreading health epidemic. First, I will discuss where it all started. Second, I will introduce the health benefits of quitting. And lastly, review the methods available to help you stop vaping. So how did this problem begin? People who want to quit smoking finally have a new alternative in August of 2006, as electronic cigarettes were first sold in the US and Europe. E-cigarettes were first being marketed as a smoking cessation device, but by early 2010, vaping had moved from a smoking alternative to more mainstream. The enormous growth of the industry sparked debate among many professionals as to the overall safety and health risks associated. The company Juul came out in 2007 and first introduced the concept of pods. One pod consists of 200 puffs, or the equivalent of about 20 cigarettes. These pods came in different flavors that attracted youth from the start. The pods also came in different strengths, most coming in at 5% or 50 milligrams of nicotine. To compare this to cigarettes, most cigarettes have 10 to 12 milligrams of nicotine in each one. That means that vapes have 5 times the nicotine that's found in a cigarette. So people who never even smoked are turning to these devices and becoming lifelong addicts. Research is actively being done to assess the health consequences of using these devices. We are years behind the studies done on traditional smoking, but there is evidence suggesting use greatly impact both the respiratory and cardiovascular systems of the body. Then what are the benefits of quitting vaping? Well, according to the Healthline.com's article, 12 things that happen to your body when you stop vaping. Just 20 minutes after you stop vaping, your heart rate returns to normal, your blood pressure drops, and circulation increases. 1 day after quitting vaping, your risk for a heart attack decreases. 2 days later, your senses improve and you are able to better taste and smell things. After 3 days, all the nicotine is out of your system, and at this point, you will begin experiencing withdrawal symptoms, which will become better with each passing day. In a month, lung health improves, resulting in less coughing and shortness of breath. 1 year later, after quitting vaping, your risk of a heart attack is cut in half. 5 years after you quit, your risk of stroke is significantly lowered. A decade after you quit, your risk for lung, pancreatic, mouth, and throat cancer decreases. And finally, after 15 years, your risk of coronary heart disease becomes similar to that of someone who never smoked or vaped. This long-term perspective underscores the importance of quitting vaping for your overall health. Now that we know all the benefits of quitting vaping, how can you quit? What methods are currently available? Well, according to Healthline.com's article, 9 Steps for Success, cold turkey may be the best method when paired with nicotine therapy replacement, along with medications like Buspar and Chantix. Also, some found talk therapy beneficial as they were trying to quit. In conclusion, we have discussed the history of how vaping started, reviewed benefits of quitting, and lastly shared methods for successfully quitting vaping. I hope this has been educational for you and will make you second think before you pick up vaping. Thank you.
That was really good. I had no idea about that. So how many days have you